This is the epicenter of the outbreak. In a city of 1 million, almost 50 new cases are reported every day. Liberia's tiny band of healthcare workers are throwing everything they have at Ebola. This is Laureen. She's a mother of 4. She's collected hundreds of highly contagious patients since the start of the outbreak. She and her crew have been called in to collect a woman who's been taken sick. It's extremely dangerous work. The ambulance team are taking as many precautions as they can. They're getting into these white suits, plastic aprons, the hoods up, goggles, and face masks. Because when they go into these homes, the woman in there, we understand, is unconscious, and it's when people are in that state that they're most contagious. Excuse me, there's a tear in your Any physical contact with the patient's bodily fluids could be a death sentence. Obsessive attention to detail can save your life. Laureen allows us to fit a small camera to her head before she goes in. The scene she's about to witness is one of horror, but for her it's a scene that's become an everyday reality. She enters the cramped home. On the floor lies what appears to be an elderly woman. Laureen is calm, professional. She stops and assesses the situation. The woman is alive. There are damp patches on the mattress. They could be vomit or blood, urine or diarrhea. Whatever it is, this whole room is infected with Ebola. One member of the team is the sprayer. His job is to constantly disinfect the ambulance workers and their environment with chlorine. Carefully, they lift the woman's emaciated body onto a stretcher. She's been lying in this room for days, abandoned by her terrified friends and neighbors. The patient herself is now a huge danger. She's an incubator, riddled with the virus. She's fighting for her life, but she needs to be isolated, and isolated fast. The ambulance crew painstakingly remove their overalls and decontaminate themselves.
Lying in a pool of blood, and
she's very sick, Laureen says, but this is by no means the worst case she's seen. The neighbors say the patient is only 38 years old. One woman tells us she's her housemate. Are you still going to live in that same house now?
Yes, I'm in the same house.
You're living in the same house?
Yes.
She is scared, she says. She'll clean the place, but she has nowhere else to go. And this is how the virus spreads. In cramped neighborhoods where a lack of sanitation and healthcare facilities fuel the outbreak. Liberia's healthcare workers are big on courage, but very low on resources. If you're sick with anything other than Ebola, you're in big trouble too. Monrovia's main public hospital is barely functioning. It's all closed down. Dr. Billy Johnson is the chief medical officer. He's fighting what appears to be a losing battle to keep Liberia's healthcare system alive. Most of the wards are closed altogether. The few that aren't are operating with a skeleton staff. Outside in the car park, we meet the Kiawu family. They're desperately seeking help for their elderly father. He's diabetic, but he's also exhibiting symptoms consistent with Ebola. Throughout the country, patients are being turned away from hospitals.
We have been to all the hospitals and no solution. So we are just waiting here for him to die in the car. That's what we're waiting for. Just to see him die, Yeah.
The Kiawus leave. With the healthcare system at breaking point, they need to somehow get their father tested for Ebola. For doctors, this is a terrible dilemma.
Our training is hands-on. You want to touch the patient, you want to feel the patient, you want to be close by the patient. Now we cannot do that.
Medical staff are the most exposed to the Ebola virus. But Dr. Johnson, one of the most senior health officials in the country, says that their understandable precautions come at a cost. There must be many people dying from other diseases that could potentially be treated, but aren't because of this emergency.
Well, that's true. That's true. People with, for instance, stroke, hypertensive, diabetic patients, those even with malaria and typhoid. We show there are a whole bunch of people dying from those diseases that are treatable.
The Kiawus drive to a clinic run by the international medical charity Médecins Sans Frontières. Men in masks and overalls help him out of the car. MSF will test the father for Ebola. If he's positive, he could very quickly end up like the woman we saw being stretchered into the ambulance earlier, and his sons and daughter could face the same fate. And how are you feeling?
I'm feeling so bad that this kind of system will be in our
But your health, I mean.
For me, I'm okay, 100% okay. I slept.
It is in Monrovia's slums that Ebola is spreading fastest. In Britain, there are 280 doctors for every 100,000 people. In Liberia, that figure is just one. Little wonder then that Ebola has been able to spread so rapidly. Later that night, we get a phone call from the Kiawus. They've got their test results. Their father does not have Ebola.
It's negative?
They've gone back to the general hospital to try to get him admitted again. This is a key moment for one man and one family. But more broadly, what we're seeing here is a healthcare system that itself has been infected by the Ebola virus and is on the verge of shutting down. The Kiawus are the lucky few. The certificate from MSF is their pass into the hospital and to treatment. As for the very sick woman who was stretchered off by Lorraine, the ambulance worker, her fate, shared by so many others, tonight remains unknown.